Am I depressed? Understanding the difference between depression and sadness. Despondency, grief, melancholy, there are many shades of sadness. It's an integral part of the human experience, from which most people can recover and move on. But what if sadness was the default, and you experienced it constantly for no reason? This is at the core of depression. Hi, I'm David Yadush, LPCC. Today we'll discuss depression and how it differs from everyday sadness. I'll also offer some tips on how to cope with sadness and advice on what to do if you suspect you have depression. Is it sadness or depression? Sadness is a feeling, albeit an often complex one, caused by a stressful or negative event. It's common and temporary. With a bit of time, we can usually find a way out of it, or it will go away all on its own. Depression, however, can persist for months or years, and it doesn't need to have a cause. It can interfere with every facet of a person's life, from work to relationships to hobbies. And it isn't just a feeling. It's a condition whose symptoms can also include trouble sleeping, eating, and concentrating. People with depression may also experience physical symptoms like fatigue and headaches without any apparent reason. What happens if you aren't sure? I mean, you might feel sad, but that doesn't mean you have depression, right? It might help to start with some self-care. How do I make myself feel better when I'm sad? Acceptance is often the first step to coping with sadness. Don't try to stifle it or pretend it isn't there. Allow yourself to feel sad without any self-judgment or negative self-talk. Remember, everyone feels sad sometimes. It's not a weakness or a sign that there's something wrong with you. Beyond that, there are self-care and lifestyle strategies for coping with sadness and moving past it. Here are some of the practical ways to soothe yourself when you're feeling sad. Eat well, exercise often, and get plenty of sleep. Avoid destructive coping mechanisms like drugs, alcohol, or binge shopping. Engage in mindfulness activities like journaling, meditation, yoga, or Tai Chi. Spend time doing things that nurture and bring you joy, such as spending time in nature or pursuing a hobby. Spend time with people or animals who love and support you. Do kind things for others and list the things you're grateful for. And finally, treat yourself with the same kindness and understanding you would offer a friend. Share with us, how do you cope with sadness? Different things work for different people. We'd love to hear what works for you in the comments below. So what if that doesn't work? Sure, connecting with nature, hanging out with people who make you laugh, and practicing random acts of kindness can help you feel better when you're sad. But with depression, spending time with other people can be exhausting. You might not be motivated to get out of bed in the morning, much less go hiking. And gratitude can seem out of reach when things that once brought you happiness no longer do. If that sounds familiar, you might be experiencing a depressive disorder. Depression isn't a phase, and it's not something you can just get over. It's a very real condition that requires treatment from a mental health professional. Still not sure if what you're feeling is depression or just a temporary case of the blues? Let's take a closer look. Can you give me a quick overview of depression? Depression is classified as a mood disorder in the Diagnostic and Statistic Manual of Mental Disorders, or DSM, which is the standard diagnostic reference set by the American Psychiatric Association. There are several types of depression listed in the DSM: major depressive disorder, persistent depressive disorder, also called dysthymia, disruptive mood dysregulation disorder, and premenstrual dysphoric disorder. It also includes depressive disorder due to another medical condition, substance, medication-induced depressive disorder, and other specified depressive disorders. This last category is used if symptoms are present, but don't meet the full criteria for a specific depressive disorder. What causes depression? Depression is a complex condition with several potential causes. Scientists believe it may result from a combination of risk factors, including biological factors like differences in brain structure, chemistry, and genetics, environmental factors such as adverse childhood experiences, ACEs, chronic stress, social isolation, and trauma, and psychological factors like low self-esteem, pessimism, and perfectionism may also increase risk. Chronic pain, chronic illness, alcohol and drug misuse, and certain medications can cause or worsen depression. Additionally, hormonal changes during pregnancy and menopause can increase the risk of depression. What does depression feel like? Depression symptoms often show up differently between people, but they're typically grouped into mental, physical, and behavioral symptoms. Mental symptoms of depression are associated with emotions and cognition. They might include persistent emptiness, hopelessness or irritability, loss of interest or pleasure in once pleasurable activities, or trouble with concentration or memory. Physical symptoms of depression might include changes in sleeping or eating habits, unexplained fatigue, headaches, or stomach problems, or even restlessness and agitation. And behavioral symptoms might look like social withdrawal, decreased motivation and inactivity, or thoughts about death, suicide, or self-harm. How do I know when sadness is more than just sadness? Emotions like sadness sometimes come with attitudes that say you should just suck it up and get over it, right? Such attitudes can deter people with depression from seeking help, leading to a depression, stigma, depression cycle. Despite its complexities, depression is highly treatable. If you think you might have depression, see a doctor or a mental health professional. They can assess your symptoms, rule out other conditions, and provide a diagnosis. Treatment options for depression might include antidepressants like selective serotonin reuptake inhibitors, SSRIs, psychotherapeutic methods like cognitive behavioral therapy, CBT, participation in support groups, or even targeted stress management techniques. Treatments for depression are typically tailored to the individual's needs and may include a combination of approaches. For example, some may take medication and participate in individual therapy. Others might find more success in individual therapy complemented by meetings with a support group. Many of the same self-care strategies one might use to manage stress can be highly beneficial for individuals dealing with depression. For example, meditation, deep breathing exercises, journaling, and spending time outside. Remember, being sad doesn't mean you have depression. As a feeling, sadness often goes away with a little time and self-love. But stubborn sadness that meddles in your daily life might signify something more serious. If you think you have depression, asking for help is a sign of strength, not weakness. With the right support, you can learn to cope with depression and move forward joyfully. If this video helped you understand more about sadness and depression, give us a thumbs up, subscribe to the BetterHelp channel, and enable notifications to keep up with our latest content. If this video inspired you to tackle your own mental health challenges, tell us about it in the comments below. Your experiences may inspire others to get the help that they need too. Thank you for watching. Until next time, take care.